South African National AIDS Council has a new CEO. It follows the resignation of Dr. Sandile Buthelezi, who left to serve as the Director General of the Health Department. The new CEO is a medical doctor with direct and extensive experience in HIV and TB health matters, including 15 years at Right to Care. And she joins us now, of course, Dr. Thembisile Xulu. Good evening, and Dr. Xulu, congratulations on your appointment, and thank you so much for your time tonight. What are some of the priority areas for you?
So I'd say thank you so much, Kathy, and thanks for having me. I think key at the moment for me is I think getting to understand SANAC as a structure and how it operates. It's a key entity in terms of coordinating the response for HIV, TB, as well as STIs, and the bulk of it is about stakeholder management. So the government, the public sector, and the private sector must not only be at the table, but they must have a voice at the table. And at the moment, I would say the private sector voice is not adequately present and not adequately heard. So that is a key priority. We are also prioritizing mobilizing funding and also prioritizing better donor coordination within the country as a whole.
And let's talk about, COVID-19 and the impact it has had on the fight against HIV and AIDS, especially when it comes to, the issue that you just alluded to now, funding.
All right, so what has happened is, there's no doubt that COVID has, shifted, I'd say, health priorities, not only in South Africa, but globally. So there's certainly, I think, room for us to put more focused action and attention so that we don't reverse some of the gains that were made in terms of HIV and TB because of the COVID-19 pandemic that we experienced. So there's room for us to promote integration of services, to share some of the lessons learned, and to share some of the infrastructure that exists in terms of improving the entire epidemic. So from our end, I think some of the challenges that still exist is that, within the HIV response in particular, there's still quite a high number of adolescent girls and young women between the ages of 15 and 24 that are having new HIV infections. And that response requires even further strengthening. We've seen some positive change, but we are nowhere where we need to be. In the same vein, the number of new infections in key populations and their sexual partners is very, very, very high. And access to combination prevention for these populations, and others needs to be improved in particular.
And talking about, access particularly to medication, it was also one of the key issues of concern during the COVID-19 pandemic, because some people were not even able to access healthcare facilities in order to be able to, get their treatment, especially those that have already been diagnosed. Where do we begin then to try and fix this and ensure that everybody then goes back to their treatments?
All right. So I think there certainly are, reports that we've seen that health-seeking behavior was significantly reduced during the lockdown period, whether it was because people were afraid of contracting COVID, at the health facilities, or because health facilities were closed down, or whether they were scared of the police or the soldiers, or just being scared of being tested, and maybe being incarcerated. The good thing is that in part of expanding the HIV response, we were already looking at switching people to a newer drug called dolutegravir, but we were also looking at implementing multi-month dispensing, which meant that our patients no longer get 1 or 2 months supply of medication when they go to hospital for their HIV treatment, but that they get 3 or 6 months supply. And what COVID did is that it greased the wheels of that happening. So we have started rolling that out to make sure that people have always got sufficient stock at home, that they don't run out of medication, that we don't have people that are lost to follow up. But more than anything, I think, it is bringing services closer to the communities. So those are some of the innovations, and the ability for people to use the government chronic courier medicines dispensing facility, which allows you to collect medication, at at your local shopping mall, you know, and at some of the big retail pharmacies. So those are some of the activities that were rolled out when COVID came through, and it just allowed us to expand and make sure that our HIV-infected patients continue to get the services that they so critically need.
The country is inching closer to World AIDS Day. What are some of, the focus areas? Are you going to be zooming in and ramping up the message to adolescents?
Yes, definitely. I think, as I said, we are particularly concerned that the number of adolescent girls and young women between the ages of 15 and 24 that are still having new infections is still quite high. If you look at the data compared from 2012 to now, there is a reduction, but it's not as significant as we'd want it to be. So I'd say we are mobilizing our donors to ramp up and to carry on the focus on HIV prevention, with a particular focus on the AGYW program, which is adolescent girls and young women. I think we are continuing to focus on community-centered and community-led approaches that allow us to do things in solidarity. And we have seen that we can only win the war, whether it's HIV or COVID, when the response is being led at community level. So I think that is a key message as we move forward, because even these young girls, belong to communities, and we need to get into communities to reach them.
All right. Thank you so much for your time tonight. That was Dr. Thembisile Xulu. She's the CEO of the South African National AIDS Council of South Africa.